everyone, I'm Dr. Toor from Amplify Eye Care here in Olympia, Washington. Today we're going to go over what's commonly known as pink eye, but also called conjunctivitis. So usually there's three types of conjunctivitis. It can be viral, bacterial, or allergic, and sometimes they all present similarly. The most classic sign of pink eye is having a pink eye or some redness in the eye, and usually some water or discharge coming out of it as well. With both viral and bacterial pink eye, they're usually pretty contagious, so it's not uncommon for it to start in one eye and then be transmitted over to the other side. And because they're so contagious, it's really easily transmitted between people to people, whether it's direct or indirect contact. And typically, so with viral, it's a pretty self-limiting condition, and with a couple weeks, it clears up. But of course, you need to stay on top of hygiene and making sure you're not touching the eyes and cleaning your hands, washing your pillowcases, things like that. With bacterial, it can be a little bit more complicated because typically there's a lot more mucus or pus coming out of the eye, and usually we need to treat that more with antibiotics and follow up a little bit more closely, but that also typically resolves fully within a few weeks of treatment. The third conjunctivitis is allergic conjunctivitis, and now that is not contagious or directly transmissible between someone, and it's typically a reaction from something in your environment or a product. Now, allergic conjunctivitis usually is also red, watery, can include some swelling and a lot of itchiness as well. Typically, it can affect both eyes at the same time, but depending on if maybe something just got in one eye, it can just be on the one side. And now with allergic conjunctivitis, if it's a mild case, it usually takes care of itself, and you can use artificial tears and cool compresses. Other cases, we might need to do some allergy drops, and then if it's a really severe case, we might also need to do a steroid eye drop. And all of these conditions usually resolve on their own, but it's important if you're having some vision changes, pain, or things feel like they're getting worse and not better, to always be in contact with your eye doctor, follow up closely with them and the instructions they give you. In this period of time, like I mentioned, you usually want to make sure that you're staying very clean, keeping the surface clean, but also your hands and everything you touch. You also don't want to be wearing contacts if you're typically a contact lens wearer in this time. You just want to leave them out for the time that it takes to heal everything. Usually conjunctivitis heals up pretty good, especially with viral. It's self-limiting, so it's going to heal on its own time. But if you have any questions or concerns, it never hurts to call your eye doctor and book an appointment with them and let them take a look. Thanks.